So now I want to discuss about, so far we discussed about the cabbage and uh, uh, cardiopulmonary bypass or uh, off-pump coronary artery bypass, while now we want to discuss about, hey, do we always need open heart surgery? Because that's a major surgery with a lot of side effect, of course. And so because of that, we developed a new ways of treating this without open heart surgery. So that's called percutaneous coronary intervention. So it's not surgery, it's an intervention, or angioplasty. So let's look at, this is, remember cardiac cath lab has a real-time CT, real-time X-ray. To give a contrast, you have to inject a inject a contrast agent. So during the short amount of time, you can actually see if the vessels are stenosed or are narrowed. So here's, I'll play a movie here. On the left part, you see this part is narrowed down while this part is open. So it's a before and after angioplasty, which means this narrowed part due to atherosclerosis, you can put a balloon to open up and make it pattern, or you can sometimes put a stent on it. So this tight critical stenosis of the proximal left anterior descending to one of the coronary artery in a patient. So this percutaneous by definition means just you have to go this stent or a catheter through the skin. So that's why we call it percutaneous, and our target is coronary and we are intervening. It's a non-surgery. We are not opening the heart. Procedure used to treat a narrowing of the coronary arteries, or we call it as a stenosis of the heart and in coronary artery disease. So the cool thing about this is no need of open heart surgery, and you could also put the catheter, not only balloon, with the insertion of stents and or naturally dissolving stents. So then a natural question is, when do we need a cabbage or percutaneous coronary intervention? You know, percutaneous coronary intervention is not a surgery, so it has a lot more safer and a lot of benefits. But maybe still cabbage could be superior if there's not just simple one or two, but many blockages, multiple. Maybe cabbage may be superior. Or a patient which has a background diabetes who may suffer from vascular underlying disease, which may have a high risk, then this cabbage might be superior. Okay, so similar one in coronary angiogram. Angiogram means showing this vessel by use of a contrast agent with an X-ray. So you can see that you don't see, that means it's a kind of a block. Once it's pattern open, you can actually see this. This is called percutaneous transluminal coronary angioplasty or coronary angioplasty. And once you put this stent into the coronary artery, this is what you can see: guide wire, catheter, and stent. And let's see about the stent as a biomaterial a little further. So especially I explained in the past that the stent itself gives a mechanical support to open up the coronary. However, the problem is their tissues already having underlying atherosclerosis may come again to leading to restenosis. So by knowing the mechanism, we can put some drug, slowly releasing drug onto the stent, so that the eluding stent can be more effective to preventing restenosis. So this is a drug-eluting stent for angioplasty, showing an electron micrograph. So you can see this as a scanning electron micrograph, and this is the base braid. Braid means this general, like, you know, in the female hair, you can make a braid. So this is called base braid, and you coat with elastomeric coating. So like recent stents, it's likely that the metals are being replaced by degradable polymers. And there we put these elastomeric materials, then that will self-expand inside the vessel without the need of balloon inflation, which is great. And then you also coat with a drug-eluting layer. So the braid provides a core material for mechanical strength. And this elastomeric coating is providing elasticity so that it can self-expand and then stay there. And this drug-eluting layer makes a long-term slow release of this drug, which prevents restenosis. So let's summarize our chapter for biomaterials. So biomaterials are a critical part of the design of artificial organs. While we haven't covered the extensive part of the whole biomaterial, I believe we covered the core part and give you some idea what's the most important knowledge in biomaterial. And perfect biocompatible material is not yet known, which means still there are problems of the biomaterials. So, however, there are many materials that function inside the body without causing many side effects. Also, it depends not only materials such as titanium, which is relatively inert, but also the location of the biomaterial might also matter. Because some parts, such as inside the eye, it's immune privileged side, there aren't many immune cells. The most common biological response to materials in contact with the blood is coagulation. So this is very, very important. And also the most important biological response to implanted material, which do not necessarily direct contact in the blood, is the foreign body response, which is our natural immune response to attack and isolate the foreign body. So far, permanent artificial heart do not yet exist, and however, there have been important progress made, and we can see still there are many progress awaiting for biomedical engineers. And thank you for your attention.